Hey everyone, welcome back to the program. Dr. Dan here, and today I wanted to talk about apple cider vinegar. Something I get asked about a lot in particular. Is apple cider vinegar useful for weight loss? And what's the deal with apple cider vinegar gummies? Do I do the liquid? Do I do the gummies? What do I need to know in terms of maybe using this and helping with my weight management journey? So to be 100% honest, I really actually didn't know a whole lot about apple cider vinegar other than it tasted horrible and it was something from the vinegar type family. So as a good little scientist, I took it upon myself to start going back into the literature and seeing what the research and science actually says in terms of, well, weight loss, but also all the other health claims that are made around it. So apple cider vinegar has a number of health claims behind it. And that's big in part because, well, the internet warriors and the Dr. Google people have really taken it upon themselves to extrapolate and exaggerate some of the findings and research that has been done in this area. Now, generally they do this as a way to kind of create some hype, some advertising, and ultimately try to scam just regular good old people out of their money to sell a kind of snake oil type product. Now, the unfortunate thing is that what I actually found was that there's actually not too bad a science with apple cider vinegar. So it's kind of unfortunate that, people will then further extrapolate to further try and sell a product. And ultimately, I think they're hurting the overall potential that a product like this could have. But I'll get off my soapbox now and I'll digress. So apple cider vinegar has been getting a lot of attention in the weight loss space. And that's big in part because, well, obesity and people gaining weight is really becoming a public health concern. It's been declared an epidemic and it's further becoming more and more of an issue that's going to possibly put some strain on our healthcare system. And while we're getting pretty good at managing obesity and helping individuals live healthier lifestyles and such like that, there's a number of treatments and medications that we have currently in place, but not everybody can tolerate those. Some of those medications do cause side effects, just like anything that we take in through our bodies. And so naturally, people are trying to find other alternatives that if they can't take, the weight loss medications or the FDA approved drugs and stuff like that, they want to try and find something else that is safe, but also tolerable and is going to help them in whatever they're trying to achieve. And well, ta-da! We now have people that are chugging back apple cider vinegar, kind of like your grandpa Gary, chugging back his rum and eggnog at Christmas time. Now, I would argue that apple cider vinegar, if you've ever tried it, and I have personally, really isn't all that tolerable, but that's something that we can debate at a different time. And the fact of the matter, I think the same kind of goes for eggnog and rum. So don't at me for that one, all right? So what is apple cider vinegar? Well, as you probably guessed, it is made from apples and it has vinegar within it. So essentially what they do is they take a whole bunch of apples, they crush them all up, then they extract the juice, add some yeast and bacteria, which then ferments the apple juice and makes it into an alcohol. Now, unfortunately, they don't stop there. They continue to add other types of bacteria, which continues the fermentation process, and the alcohol, via some magical pathway, which I don't remember from organic chemistry, then gets converted to acetic acid or vinegar. And voila, what you have is apple-y, cidery vinegar, essentially. Now, whenever something is making a health claim or even just anything in general, I always like to kind of take a step back and just be, does this make sense, right? So apple cider vinegar has vinegar in it. And I'm sure if you've ever talked to an older, wiser person like your grandma, grandpa, that sort of thing, they've probably said that vinegar makes a fantastic cleaner for wiping down surfaces, maybe even washing windows and that sort of thing. And in terms of, wiping down surfaces, being used as kind of an antibacterial, anti-disinfectant agent, well, this makes sense. Vinegar is acetic acid, and acetic acid is an acid. We know that acids can disrupt cellular membranes and kill bacteria. So that right out the gate kind of shows that, yeah, okay, maybe there is some validity in that respect of it. And then the other weird people in our world just take vinegar and ruin perfectly good French fries. So some of the health claims that apple cider vinegar has is that it lowers insulin and blood sugar, it lowers your blood pressure, it can be used in increasing your metabolism and burning fat, antibacterial, disinfectant, that sort of thing. It may decrease your risk of cancer. It may also help with heartburn, which I don't really understand because heartburn is caused by acid and we're essentially adding an acid. So Don't ask me where that one came from. I didn't actually dig deep enough to try and figure that out. And some people have said that it may lower your cholesterol and improve your heart health. Now, the list is by no means exhaustive that I just kind of gave you guys, but essentially there is a number of health claims out there, and some of them, as you kind of continue through your Google search, may start to make less and less sense. And that's kind of what I found, is that it was just people were grasping at straws to try and say it does X, Y, and Z when there's no rhyme or reason or even any data to say that it does that. So be mindful of that, and I kind of just grabbed the ones that were kind of some of the main ones that people might put out there. So as always, what does the science say? What does the data actually tell us? So first off, we're going to look at this study right here by Gopal et al. So him and his pals got together, or her pals, I'm not entirely sure. And what they did is they took apple cider vinegar and they created a whole pile of different concentrations, all from low concentrations to high concentrations. And what they then did is they looked at its killing ability in terms of a number of different species of bacteria, many of which could potentially be harmful if they infected the human body. They also looked at a couple of yeast, and they looked at the influenza virus. And the final thing that they looked at was the cytotoxicity of apple cider vinegar. And what cytotoxicity means is essentially the ability for something to kill healthy living tissue. So it would be to kill essentially human tissue. So what Gopal and their pals found is that, yeah, apple cider vinegar is quite effective at killing a number of bacterial species, both from at the low concentration and at the high concentration as well. Now, apple cider vinegar was found not to be very effective against, yeast and fungi, so candidae and that sort of thing, which in general, that kind of makes sense because they do use yeast and fungi for the actual fermentation process. So it would need to be, the yeast and fungi would need to be resistant to the apple cider vinegar in order to basically do the fermentation to create the vinegar and that sort of thing. Now, unfortunately, it didn't have any kind of effect against the influenza virus. And I didn't specifically look into it with regards to COVID, but I'm going to kind of assume the same or very similar. And that's big in part because influenza and COVID are slightly, not really, kind of related. Kind of think your second cousin twice removed, if you will. So they have some similarities, and I'm willing to bet it probably isn't that all effective against it, and we should be using actual, true, proven virucidal agents. Now, what about the effect on human tissues? Was it cytotoxic or not? And well, yes it was. Even at low concentrations, apple cider vinegar can kill living tissue cells. So that is kind of concerning, is that it definitely can cause some harm. And it's likely not to be like, you have one shot and you're okay, you're probably still going to be okay. But if you have multiple repeated shots, it's going to kind of break it down and kind of do kind of an erosion type pattern, if you will. So definitely apple cider vinegar can be cytotoxic and yeah, definitely problematic in that respect. Now, I do need to mention that all the studies and basically the data that they collected was all done in petri dishes. It was done in a lab, in a dish. They added the apple cider vinegar to a bacterial culture and kind of saw what happened. It wasn't actually looking at someone drinking apple cider vinegar because they had a sore throat or something like that and seeing if the bacteria was wiped out. In fact, I would probably bet that the apple cider vinegar isn't going to do anything for your, your throat infection, strep throat, sinus infection, or say a lung pneumonia, even a bacterial wound infection or something like that. So please don't forego the antibiotics. There's completely other structural mechanisms that are going on there, and apple cider vinegar likely isn't going to help you for any of your own personal infections, but maybe for cleaning your surfaces. Yeah, makes sense. We've already said that. Grandma knew, so now you know too. All right, our next study goes over to Hamla and their friends, and they looked at the antioxidant type effects with apple cider vinegar, as well as its ability to improve cholesterol levels and that sort of thing. Both of which, inflammation, high cholesterol levels have been linked to obesity. So the idea being here is that, well, if we can give you something like apple cider vinegar and help to mitigate some of these metabolic stresses, well, why not? What do we got to lose, right? So in this study, the authors took rats, and what they did is they took a number of rats and split them into 3 groups. There was a control group or placebo group, so they basically got nothing. They just kind of did the standard rat things that rats do and the standard diet that rats eat. And then they had what was called a high-fat diet. So the purpose of the high-fat diet was to kind of simulate maybe what the North American diet is like, but also to kind of drive those inflammatory, weight gain, and some of those things that maybe an individual that has obesity, maybe potentially the diet that they may be consuming and eating. So they had a high-fat diet group, and then they also had another group, which was the high-fat diet group, but they added apple cider vinegar. So the purpose of this was to kind of show that compared to the high-fat diet group alone, does apple cider vinegar have a benefit? is there going to be changes and differences between those two groups, and all of it compared against the placebo group. So the rats were fed all these diets for a certain period of time, and then the poor little guys were then at that point sacrificed. Their tissues, organs, and blood and stuff like that were all extracted and then examined. So they found a couple of interesting things. First, we'll look at weight. What they actually found is that in the high-fat diet group with the apple cider vinegar, there was less weight gain compared to just the high-fat diet group alone. Both groups did increase more weight compared to the placebo and the controlled group, but that's kind of expected. They were just being fed more calories on a day-to-day basis. But the apple cider vinegar group, the apple cider vinegar seems to have attenuated or slowed the weight gain process. What they also found is that the group that was eating and having apple cider vinegar added to their food, or in some kind of fashion or form, seemed to also be eating less food. Now, the authors kind of speculated that apple cider vinegar might suppress appetite and that sort of thing. But in this study, it wasn't entirely clear how the apple cider vinegar was being added to the rats' diet, whether it was added via their food or other means and measures and stuff like that. But again, if you've ever had apple cider vinegar, and if someone was intentionally adding it to my food, I can tell you that I probably wouldn't want to eat a whole bunch of that food either. So is it actually suppressing appetite, or is it more the fact that just apple cider vinegar tastes like butt and these rats were kind of like, yeah, no thanks, we're good, okay? So next up, looking at, say, liver enzymes and the anti-inflammatory processes of apple cider vinegar, what they found is that there was a reduction in liver enzymes, and there was also a reduction in some of the inflammatory markers. So that may indicate that that there was less fatty liver gain, which definitely is a complication and a concern in terms of obesity, but there was also less inflammation that seemed to be present. So apple cider vinegar seemed to have a antioxidant type effect. And there was also an actual improvement in cholesterol levels. Now, the cholesterol in the high-fat diet and apple cider vinegar group was still higher than the placebo-controlled group, but it was lower than just the high-fat diet group alone. So apple cider vinegar did attenuate or stop some of the negative effects that can kind of come with the high-fat diet, but it doesn't attenuate or stop them all, just negates some of them by eating that high-fat diet. So has some effect on managing cholesterol levels, potentially, at least in rats. Now, the authors went into a whole bunch of proposed mechanisms and ideas, and really what I found is there was kind of more questions that came up than what were really answered, and ultimately the biggest one was, well, is this going to work in humans? And we'll get to that in a second. Now, what about the anti-cancer, anti-tumor properties? Can someone forego, the horrible chemo life-saving, proven chemotherapy and radiation and stuff like that and just chug back some apple cider vinegar and cure all their cancer woes? Probably not. In fact, I would highly, highly recommend it. If you still choose to go down this route and chug apple cider vinegar instead of getting actual chemotherapy and, once again, proven and effective therapies in terms of treating cancer, that's okay, you do you, but please stop telling other people to do the same and giving them false hope with apple cidery acid, essentially. But what they found in a couple of studies was that, yeah, apple cider vinegar can kill tumor-based cells or cancer-based cells. Again, this was all done in a petri dish. This is pretty similar to what a lot of health products are compared to and measured against by doing it in a petri dish. You pour some of the product, in this case apple cider vinegar, on the tumor cells. Oh, hey, the tumor cells died. We already talked about how apple cider vinegar has cytotoxic effects and it can kill living cells. Cancer cells are just the same. They're living cells. Apple cider vinegar can kill them, but it can only do it in a petri dish, not actually inside your body if you chug the actual apple cider vinegar back. Now, for my friends that have diabetes, apple cider vinegar in a few studies here seem to show that, yeah, it can actually help to lower blood sugar levels after a meal. So not just in general, but more specifically after you have a meal, blood sugar levels seem not to spike as high. Now, this was attributed to the fact that maybe apple cider vinegar seems to have an effect in terms of slowing gastric emptying. So basically, it slows down the transit of food from your stomach to your small intestine. Therefore, food sits in your stomach for a longer period of time, and more slowly does it go into the intestine and then release sugars into your bloodstream to ultimately cause your blood sugars to rise less rapidly. So there's more of a gradual curve, if you will, and it comes back down, so less of a spike in that respect. Now, interestingly, this slowing of gastric emptying or slowing of transit of food might also explain the appetite effects, because again, food is sitting in your stomach for a longer period of time, so you're just not feeling like eating as much food or anything like that. So the food sits there, you're not as hungry, you have greater satiety, all those kinds of things, so your appetite ultimately is reduced and you eat less food. And guess what? There's actually a class of obesity medications, at least temporarily also have this effect. They're called GLP-1 receptor agonists, and two of the big ones are Saxenda, Ozempic, and what they ultimately do is, for a temporary period of time, while your body's getting used to the drug, they slow that process of gastric emptying, they make food sit in your stomach for a longer period of time, and ultimately cause you to feel fuller and decrease your appetite. Now, that all sounds fine and dandy and everything like that, but we really don't know what exactly that means for people that don't have diabetes. Is there really actually a benefit? If you don't have diabetes, your body is quite good at managing the sugars that are coming into your system, produces the appropriate amount of insulin, and brings your sugar levels down. Really, is it going to do a hell of a lot? People will talk about insulin, and there'll be a future video on that, on what insulin does and its importance and that sort of thing. But is it actually really going to do anything for people that don't have diabetes? In those people that do have diabetes, okay, yes, your sugars don't spike as high after having a meal, which can be a good thing in some respects. We don't really know what long-term data and stuff like that really means. But the one caveat that I do have is that, well, having something like this can make your blood sugars more unpredictable. We don't essentially know what's going to happen to your blood sugars if you have some apple cider vinegar and all of a sudden your blood sugars are blunted. If you're giving your regular doses of insulin, what can potentially happen is that you might go low. You might have a hypoglycemic episode. And there's actually, in some of these studies, a number of patients had hypoglycemic episodes because their blood sugars were dropping out and they were still giving their regular doses of insulin. So it creates that lack of predictability in your blood sugars and what's going to happen, and certainly can be harmful to you, to an individual that has diabetes. So I'm going to recommend not to use it. So after kind of going through about, the 7th or 8th animal trial that was trying to prove one of the above health claims and make up a whole bunch of proposed mechanisms, and also my 3rd or 4th human trial that was just absolute and complete garbage, I kind of got bored, and so I decided to skip ahead to the studies that I found actually interesting and maybe were going to be most beneficial to you and provide you some actual feedback as to what does apple cider vinegar do for humans, and is it worth your time and especially your money? Now, a group, Kondo et al., so Kondo and their friends, what they did is they got together and they got a whole bunch of Japanese patients that were classified to have obesity. Now, a quick aside here, in Japan, obesity is considered, you're considered to have obesity when your BMI is between 25 and 30. Here in North America, our classification of obesity is anybody that has a BMI of greater than 30. 25 to 30 BMI is someone that would be classified as overweight in that case. So there is that slight differentiation. Just wanted to give you that tidbit in case you happen to stumble across that study yourself and are trying to figure things out. Anyways, what Kondo and friends did is they took a whole bunch of people that had obesity in Japan, and they looked at a number of different markers, including cholesterol, its effect on weight, blood pressure, blah, 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 blah. So they look at a whole bunch of different factors and blood markers and stuff to try and see, does apple cider vinegar, or in their case, actually, they looked at vinegar specifically, have any benefits in terms of these respects. Now, as I said, in this study, they specifically used vinegar or acetic acid, which is thought to be the active component of apple cider vinegar. So they didn't quote unquote use apple cider vinegar itself. They used the active component of it to see if that had any kind of benefit in terms of all these various markers. And what they did was a randomized, double-blind, placebo-controlled trial, which is kind of our gold standard in terms of evidence, depending on who you talk to and stuff. But essentially what happened in this case is they got a group of people together, mixed them all up randomly, assigned them to a group, and then the patients, the individuals that were participating in the study, were blind to who was getting acid or who wasn't, as well as the researchers were. So no one knew what the hell was going on. So I always like to kind of akin it to a going on a blind date with somebody, and then you're both ordering drinks that taste so delicious and good that you're not sure if they have alcohol in them or not, but ultimately someone ends up going home disappointed and sober. So in this study, they recruited 150 people and they created 3 groups. And they essentially had 3 kind of treatment, well, they had one specific treatment period, and then they also had a 3-week pre-treatment period. So they got everybody basically on the same page with regards to supplements and that sort of thing. Then they had 12 weeks where some people were given acetic acid and some people weren't, and then they had a 4-week post-treatment period. So basically they stopped giving the acetic acid or the placebo, and then they just kind of monitored and watched the people for another 4 weeks. And in the study, they had a placebo group, which is fantastic because a placebo group, or at least in randomized controlled trials and stuff like that, what we know is that when people believe that they're being watched and stuff like that, they tend to do better. They tend to engage in more health behaviors and that sort of thing. And in particular, if this would be like a weight loss study and saying, hey, you're going to get something that's potentially going to give you some oomph for losing weight, well, people are more likely to adhere and be more strict with everything for the 12-week period. So the placebo group is kind of identified and meant to kind of help mitigate a lot of that bias, essentially, that'll come up. Anyways, the two other groups, they had one group that was the low-dose acetic acid group, and they got about 750 milligrams of acetic acid. And then they had the high-dose acetic acid group, which they got about 1,500 milligrams of acetic acid. So to kind of give you a bit of a quantification of this, that would be about, the low dose would have been about 1 tablespoon or 1 teaspoon, no, it's 1 tablespoon of apple cider vinegar, and in the high dose group it was considered to be about 2 tablespoons of apple cider vinegar. So on to the exciting part. What did they find? Well, in terms of weight loss, what they found is that the subjects on average in both the low dose and high dose group seemed to lose approximately 1 to 2 kilograms of weight over the 12-week period. Now, 1 to 2 kilograms per weight, that equates to a little less than 0.5 pounds per week, which isn't too unreasonable. Generally, when I'm working with my patients, we aim for about a 0.5 to 1 pound weight loss per week. Now, a point that I really want to point out here is that after the 12-week period, so there was about this 1 to 2 kilogram weight loss, the patients then entered that post-treatment period where they basically just went back to regular life for a 4-week period. And every single person, it seems, or at least the average anyways, most of those individuals that lost weight promptly gained all the weight back in that post-treatment period. And that furthers to the thing that I always say is that whatever you do to lose weight, you have to maintain it long term. So you potentially would need to stay on apple cider vinegar or acetic acid treatment for the long term in order to hopefully maintain that weight loss. Now, in saying that, the study was quite short. It was only 12 weeks. And in reality, to really know if a treatment is effective in managing an individual's weight, we need to really stretch it out to at least a year, because what we know is that for a period of time, yes, people can do what they need to do to lose the weight and keep the weight off. But when we start stretching out into a year, that's when we start to see weight regain start to happen in general. And that's because people, well, they go back to their normal lifestyle and stuff like that. So if we were to stretch the study out to over a year, would we ultimately see people gaining the weight back? Maybe, probably, most likely, regardless if they were still taking apple cider vinegar or not. So something to keep in mind, and there really wasn't any long-term studies in this respect. Anywho, this study also looked at cholesterol levels and that sort of thing, and what they found is that there really wasn't a reduction in LDL or the bad cholesterol, but there was a reduction in what we call triglycerides. Now, triglycerides are not LDL, they're not bad cholesterol, but they have been linked to things like heart attacks and strokes. We're still learning more and more about them, and they're becoming increasingly important and something that we definitely need to manage, but ultimately we did see a reduction in them, so that's probably a good thing. So very interesting finding in that respect. And in reality, that was about the two main benefits that we saw. A little bit of weight loss and a reduction in triglycerides. As I said, the authors looked at a whole bunch of other things, including blood sugars, blood pressure, other cholesterol markers, that sort of thing, and there really wasn't any difference between the placebo-controlled group or the groups that got the acetic acid. So that kind of tells us that maybe everything that they're finding in the animal studies isn't as cracked up as what it is. And yeah, this really has to put a lot of weight into terms of, is this actually going to provide any benefit if you were to take apple cider vinegar? Apple cider vinegar, in terms of humans, that was probably the best trial that I did see by Kondo and friends. Yeah, I would say it's probably not going to provide the magical weight loss benefits that we're looking for. Maybe if you have a pet rat named Rodney, it might have some benefits in helping to prolong little Rodney's life. But short of that, for you taking it, probably, maybe, might have some weight loss benefits, might have some effect on triglycerides, but does that mean anything long term? Again, we don't know. The authors didn't look at it long enough. It was too short of a trial and that sort of thing. But overall, pretty well done trial. So if you're still not convinced that apple cider vinegar isn't the greatest thing since sliced bread, let's look at the potential and actually very real harms. So apple cider vinegar, acetic acid, is an acid. Now, you drinking acid is not going to be like the movies where they overhype it and basically you'll dissolve from the inside out and die. Like I said, it's going to be more of a long-term erosion factor, especially if you're a psychopath and chugging that stuff straight. What's ultimately going to happen is it's going to slowly erode at things like your esophagus, the enamel on your teeth, and that sort of thing. And yeah, potentially be very harmful. Erosion of your esophagus can cause bleeds and other issues. And even the internet experts do recommend not chugging it and doing shots of apple cider vinegar. They do recommend diluting it and using a straw apparently to help circumvent the whole aspect on your teeth and your enamel. In terms of some other things that go on in the body, apple cider vinegar has been potentially shown to affect your electrolyte levels, in particular your potassium levels. Potassium, you know, as people have said in different salts and that sort of thing, potassium is important for muscle contraction and in particular for helping our heart contract properly, which we need potassium to be at the proper levels to properly pump our blood and all that kind of stuff so the heart can contract and stuff like that properly. So if your potassium levels are out of whack, that can cause a real problem. In particular, if you're also on medications that affect your potassium levels, this could be a dangerous and potentially fatal combination. And finally, as I said for my friends that have diabetes, is this going to have some effect on your blood sugars? It may potentially. It may cause them to be lower. It may cause them to be unpredictable. It may cause hypoglycemia. So for those individuals that have diabetes, I'm going to strongly urge that you do not use apple cider vinegar. And if you, for some reason, believe that you still need to, you need to be monitored properly by your clinician, doctor, pharmacist, whatever, to make sure that you're using it absolutely safely. But again, do not use it to be just as safe as possible. So my final thoughts on apple cider vinegar: is it this magical, mystical product that's going to help us with all of our ailments and help us lose weight? Probably not. The Karens of the world and the various other internet experts and stuff that don't really know how to interpret evidence will tell you otherwise. But in reality, most of the data and research has been done in animals. And in that comparison that I showed you with the actual human trials, the same results are not seen in humans as what we were seeing in animal studies. Now, research is ongoing, so that potentially could change, and I'm more than happy to re-review and be told that I'm wrong, but I'm highly suspecting it's still not going to be all that great. And for crying out loud, it's an acid. Like, why would you want to chug back acid and cause other problems for yourself? So some food for thought in that respect. Now, what about the apple cider vinegar gummies? Well, big in part, my first thoughts is that they use the gummies to make apple cider vinegar a bit more palatable. Because again, it tastes like ass. Just straight up. Gonna be straight up with you guys. It tastes horrible. So if you can make it into a gummy and add some sugar and other flavoring and make it taste a little bit better, sure, why not? Now, I did do a brief little search around this and trying to figure out, is it equivalent and that sort of thing. And what I did find by looking on Amazon and various product labels and stuff is that these gummies or capsules, what they would say is that it has 500 milligrams of acetic or apple cider vinegar in it with 5% acetic acid. Now, if you remember from that condo study that I told you about, acetic acid is the active component. So 5% of 500 milligrams, if my math is correct, which it very well may not be because I did fail calculus, but that would equate to about 25 milligrams of acetic acid for a capsule or a gummy. And if you recall again from that study, what they were looking at was people getting 750 milligrams or 1,500 milligrams of acetic acid in order to get the weight loss and triglyceride lowering benefit. So if you're only getting 25 milligram per capsule, gummy, whatever, are you actually going to get the full potential benefits? Or are you really going to have to chug like a bottle of these gummies or what have you to actually get the proper dose to get the potential benefits? And so kind of some food for thought there. It may not be properly dosed. It's just kind of flavored better, which, okay, yeah, tastes better and stuff. But if it's not even at a dose that's going to give you any health benefit, why waste the money to get a bunch of acid to drink? In fact, you're almost better to get some edibles or real gummy bears because you're probably actually going to get some real benefit and have a lot more fun doing them. So just some food for thought, guys, on that respect of it. Now, if you've hung out with me this far in the video and stuff like that, I'm always going to kind of go back to and recommend that good lifestyle choices, looking at proper nutrition, activity, good mental health, sleeping well, those are the things that are ultimately going to help you to manage your weight in the long term and really are what are important. It's not going to come from some kind of magical, mystical supplement or anything like that. You may need actual proven medications or even possibly bariatric or metabolic surgery to help you to manage your weight, and that's totally okay. But I have a hell of a lot more data and information around those. So some food for thought. I hope that answers your questions with apple cider vinegar. As always, don't forget to hit the subscribe button to tune in and make sure you don't miss another episode with me. And you can follow me at the official Dr. Dan pretty much on all the platforms. Come check me out, ask me a question, and leave the questions and comments down below and let me know what you think. All right, have a good one, guys.